Good afternoon, everyone, and welcome to today's media availability. I will now turn it over to Dr. Janice Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media availability yesterday, we have no new positive cases in the province, so our total number remains at 260, with 242 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male, with 22 people under the age of 20, 38 between 20 and 39, 38 between 40 and 49, 58 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 3 people are in hospital due to the virus, and of these patients, 1 is in intensive care. 253 people have now recovered, and in total we have tested 10,841 people. Each passing day with no new confirmed cases of COVID-19 gives us hope for more normal times ahead, while proving that our every action counts. The advances we have made against this virus to date are a credit to each of us, and the same can be said as to how it progresses moving forward. As I said yesterday, just because we are not seeing a lot of cases right now does not mean the measures we have in place are no longer needed. In fact, just the opposite, because of these measures and your dedication to following them, that we have fared so well. This has not been easy, but our lives will not always be restricted. Progressing through our provincial COVID-19 alert system will take our combined patience and cooperation as we proceed with caution and care. This is about our safety and those we love. We must get it right. Every public health decision we make is carefully considered, based on risk assessment and closely monitored. These decisions are not made lightly, but in the best interest of us all, with our health and safety always at the forefront. Our provincial public health system has done its very best to protect our population and will continue to do so going forward. Thank you all for continuing to work with us to help achieve this goal. Keeping our case numbers of COVID-19 down means keeping our public health measures up. Please stay home as much as possible, especially when you're unwell. Cover coughs and sneezes, wash your hands often and well, maintain a safe physical distance from others when in public spaces, and wear a non-medical or cloth mask when that's not possible. These measures remain our best protection against this disease. Although there is still work to be done, I've no doubt we will continue to navigate living with COVID-19 together. We have already made considerable progress, and I am reminded regularly we are a strong, brave, and resilient province. Our unwavering efforts have helped bring stability in the face of this pandemic and have instilled in us a sense of optimism and hope that I'm certain will see us through to better days. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, and good afternoon, everyone. So I think I'm going to consider this lucky number 13. 13 days straight of no new cases in Newfoundland and Labrador. So to all our residents throughout the province, thank you once again. You have been doing a really good job in shutting the door on this virus by practicing good hygiene and safe physical distancing. This wouldn't be possible without your hard work, your diligence, and your patience. We recognize these are trying times, as Dr. Fitzgerald just said. It hasn't been easy on your families. The last couple of months has been challenging for Newfoundlanders and Labradorians, and indeed for all of Canada. Activities that we once took for granted, little simple things like just dropping in to see family and friends or just dropping by a store to pick something up. But today, these are things that you had to plan your day around. You had to plan for those, just not drop in. So I appreciate that people want to go back to a new normal, and they want to know, but they also want to know what the future holds. The thing is, life as we knew it is changing. Our future will look different, but that's not a bad thing. We know that Newfoundlanders and Labradors, you know that you can adjust. We know that we can adapt. Over the last few weeks, we have made decisions that hasn't been easy, decisions that haven't been even perfect. But these are decisions, and they were made with your health in mind and the future of you and your families in mind. When we take a step back, when we just reflect and think about where we could have been, we can appreciate the importance of why the health measures have been put in place. The measures, they are about protecting you each and every day and each and every member of our community. With every step that we take into the future, that goal will be the forefront of the decisions that are being made, and they will also be the forefront of the decisions that you are making. Because we know and understand that people want to start adjusting to a new normal, and that's a good thing. We need to be optimistic and plan our lives around living with COVID-19, and that will guide us to our new normal. The thing is, we have low numbers, not because of the measures that are put in place, but we have low numbers today simply because you have been doing a good job in following them. So with our next steps, we have been balanced with the motivation to keep the numbers low to prevent a resurgence before we gradually open the economy to get people back to work safely. As a province, we have supported Dr. Fitzgerald's thoughtful public health measures to prevent the spread of COVID. As we've seen from many different areas of the world, and as Mr. Haggie rightfully said, this is a virus that spreads like a wildfire. You or none of us that we know want to be the spark that would start another wildfire. Because if you go back just less than 2 months ago, if you remember, it took one or two people to spread it to almost 200 people into Newfoundland and Labrador. That example is startling and can be a wake-up call to how quickly it can move. Our plan going forward respects that the virus is still here at our doorstep. With that, we are looking forward to the future and what the movements to Alert Level 3 will do and will mean in our lives. That's when we will see more business opened, or new services will be available. We know that it's been tough on our business community. Many of those business owners, they've invested their lives into their businesses, and we've been working and engaging with them. We have been providing, and they have been providing us with significant input and recommendations as we now can assist them to moving forward through this pandemic. We know that they're asking for, and we need to be swift in our actions in order to mitigate and support businesses through this crisis, both in terms of mitigating the short-term impacts and strategically preparing them to do business differently in the future. We are looking to provide everything from regulatory changes to financial support and the expert knowledge and the experience that we can learn from one another. Currently, we are developing an integrated suite of initiatives focused on supporting our local economy, with a view of determining COVID-19's economic impacts and recommended actions for our government. Now, earlier today, the federal government announced more in the way of rent assistance. I know for many of you, this is something you've been waiting for. They have updated the criteria for the Canada Emergency Commercial Rent Assistance Program, and this will be cost-shared between the tenants and the landlords, and the province will be involved. This will provide a forgivable 50% of loans to landlords in April, May, and in June. This will be provided with an understanding that you meet certain criteria, like agreeing to reduce the small business tenant's rent by at least 75% of a rent reduction agreement. But it will also mean that the tenant, one of the conditions will be that the tenant and the landlord will not be, or the tenant would not be evicted from the property. The small business tenant would cover the remainder of the 25% of the rent. So this is a program with a change in some criteria. It will be open on May the 25th, and this information, more information, can be found on the Canada Mortgage and Housing website. This is something that I know has been a concern for many businesses, landlords, and tenants for quite some time. Also today, as a reminder, the Canada Child Benefit payment will include the extra $300 per child, money that is being made available to help parents and guardians get through this tough time. So that's an extra $300 per child. So we are also looking at every opportunity that we can to mitigate and respond to the needs of our businesses and our economic sectors within our province. The work is currently underway, and we'll continue to do this work, and in the coming days we'll have more to say on what support that we will be able to provide in the future. Now, also, there's been a lot of discussion over the past few days about people who are being granted access to enter the province. Dr. Fitzgerald and her team has put some strict public health measures in place. It's actually today that marks 9 weeks of the public health state of emergency. Measures that include restrictions on entering our province. But it's also including changes and amendments to pieces of legislation like Bill 38. Amendments that were made to find a balance between the law and the measures needed to stop the spread of the virus in Newfoundland and Labrador. And since May the 4th, as an example, we have had over 2,600 exemptions that have been approved. There's been about 214 that have been denied, and 67 have been reconsidered. So when approval is granted, they enter into the province, and there are measures that are put in place to protect the public health and public safety of our province. There's a mandatory declaration form. There's a 14-day isolation plans that must be in place. And we also place inspectors at all the points of entry, including all the points in Labrador and within the island portion of our province. As an example, we've had 280 people who entered the province yesterday at all the points of entry. So you can tell the numbers are extremely low when you look at the fact people do sometimes have to travel for work. Now we have some good, strong measures in place. The last thing we want to happen is to compromise on the progress that we are making or threaten the health of family, friends, or neighbors. As we continue to open up our province, let's continue to work together and move forward to what is the new normal as we learn to live with COVID. So stay safe, everyone. Continue to practice good hygiene and safe physical distancing. Let's keep those numbers down. Right now, I want to take this opportunity to pass it over to Minister Haggie for his remarks today.
Thank you very much, Premier. Again, no news, a zero. It's not often that a zero is actually a sign of major success, and I think it's another opportunity to congratulate the vast majority of Newfoundlanders and Labradorians who have obviously worked hard, listened to advice, and done what was asked. We here and these media events are often more focused on a much smaller number of rumours or people who may not have behaved as we would have hoped. They are still an area of concern, and I would encourage anybody who sees that or has direct knowledge of it to use a report form for that rather than necessarily social media, because while social media might generate some shares, it won't actually necessarily generate any results. And to those of you who feel that they are abridged or unfairly treated, there are means of appeal, as the Premier has referenced. And I would encourage people to look at this through a public health lens and not look for loopholes. But again, the vast majority of Newfoundlanders and Labradorians have done more than was asked and have been incredibly supportive, judging by the emails I've received. A Premier referenced that we are looking towards the business response team. I've spoken with MAE, and they have a municipalities task force as well. So that machinery is there for groups who need it. The website is the place to go if you need information, and I would encourage everyone to do that because misinformation still abounds. Really, this is another day where we need to, as Dr. Fitzgerald says, hold fast, hold the line. You have a bubble. It's a bigger bubble now than it used to be. Look after it, respect everybody else's. And with time, we will be able to safely move to alert level 3. So with that, Premier, I'll hand it back to you. Thank you.
Thank you, Minister Haggie. And we now open it up to the media for questions for today.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues only. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Peter Jackson of The Telegram. Please go ahead.
Hi. Yesterday was World Family Doctor Day, and I I'm curious with respect to physicians, how will private office clinics be able to open with social distancing regulations, et cetera, that go on with COVID-19, considering they often have high overheads to begin with?
I think from my point of view, Peter, we have been in discussions on a regular basis, I would say weekly, but occasionally that may have lapsed a little bit. Sometimes it's more than that with the NLMA, the Newfoundland and Labrador Medical Association. The options for virtual care have been significant success, and that gets round the issue of proximity around distance. It also gets you away from a waiting room where sniffles and coughs and sneezes may be rampant. It also provides them with a revenue which is in actual fact better than the typical face-to-face office visit for simple and uncomplicated primary care issues. This was put in place to tide us over COVID-19, and certainly virtual care has been something that both the Medical Association and government have been really keen to develop still further. And as we go into more formal negotiations with the NLMA about this, I see that as a significant way forward. It's part of their 10-year plan, and it's part of a provincial and a national scheme. So virtual care will take care of a significant proportion, I think, of some of those concerns.
Okay, I understand that virtual care code pays less than half than a regular, new patient consult. Is that going to affect the ability of new patients to access family doctors and specialists?
The issue of the quantum of the code, this was put in place as an emergency measure and is valid only for the period of the pandemic. We are entering and have given notice each to the other of formal process for negotiation. We will be having those discussions in a different environment, but we will be having those discussions on a go-forward basis. The issue of fee codes is always a live one when it comes to negotiations, and that will be handled by our processes that we've had over the years. So I would reserve comment on that because it is actually something we've agreed to do. We said we would not negotiate in public.
Okay. Lastly, the medical aesthetic treatments, such as laser, chemical peels, Botox injections, they don't allow the wearing of a mask, at least for the client. Will these procedures be allowed to proceed and under any of the alert levels?
So I think we have to look at the risk for exposure in those situations, and we certainly have given advice as to how things can be done safely, but ultimately the person who's performing the procedure will have to determine whether or not they're going to be able to perform those procedures safely and in them, with the public health principles in mind.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
I know this has been asked in the past in terms of workers that return to the province and need to self-isolate for their 14 days and their turnaround. But many are wondering, just to clarify again here, if their families also need to self-isolate for those 14 days, and if there's any work being done to potentially test these workers if their turnaround is only 4 or 5 days, so that they can interact with their family.
So the self-isolation does not apply to their family members. It applies to the workers. Testing of these, again, the issue with testing is that it's at one point in time. It's not necessarily, you can have false negative tests, so you have to be concerned about that, and then you get a false sense of security. Obviously, the principles of trying to maintain social distancing as much as possible are something we would recommend, but families have to make decisions for what's in their best interest as well. And certainly if anyone had any symptoms, we would recommend that they contact 811 and consider getting tested, and then obviously to isolate themselves strictly from their family members.
Thanks for the clarification. looking through the levels here, if businesses that say aren't to operate to level 2 decide that, you know what, they've put their proper protocols in place, or to what they believe they open in level 3, for example, what are the repercussions for this, knowing that they're not a part of that actual level?
So you're thinking about a business that opens up in level 3 that are not scheduled to open up in level 2, Kellyanne? Was that your question?
Yeah, so for example, an overnight campground that's not to open till level 2, but is deciding, you know what, I'm going to go ahead with it level 3.
Well, anyone, when you look at the various levels that have been put in place, they've certainly been made public now since, for a few weeks now. So it was important, that people would have an understanding of when the next level would apply to them. So it's no different than anyone that seems to be, breaking, what are the special measures that have been put in place, these orders that have been put in place. We expect people to follow them. There is a reporting mechanism in place, but also I think the chief medical officer and her team has been made it quite clear. They are working with people like the RVs and campground, owners, and doing the risk assessment that's important here. So, we've made it quite clear, I think, today that we're in this situation that we're into today simply because Newfoundlanders and Labradorians have followed the guidelines that have been put in place. If we just continue to break those guidelines, well then, what we would see is like you've seen in other jurisdictions around the world where there's been outbreaks and flare-ups and setbacks and so on. If we find ourselves in that situation, then we expose, healthcare workers, essential workers that are currently in place. So, there's no question these are difficult decisions. But as we open up, we must be able to open up safely and have measures in place that we can protect our public in large, because it doesn't take much sometimes in a small province to have a significant flare-up. So, campgrounds, they'll work with the chief medical officer and we'll get them. We understand that people want to go camping, but we must also understand that you have to do it safely.
Thank you. My final question here. When it comes to long-term care homes and with the double bubbles and the bubbles we're seeing, how does this work for them within the homes? Are they allowed to bubble with another resident, or are they pretty well in self-isolation in the room till some of these measures are lifted?
That's an interesting question, Kellyanne. Sorry.
Okay.
Did I interrupt somebody? If
no,
so,
fine.
I do apologize.
That's fine. No, it's fine. Go ahead.
The issue around long-term care, some facilities actually do have multiple occupancy. They're semi-private. They have 2 in a room. And effectively, they are a bubble and have been since the start of COVID-19. In personal care homes, there has been discussion about what should or could constitute a bubble. And I know that discussion is still ongoing. And at the moment, the requirements are quite plain. But as the situation evolves, it may well be that we would look at a slightly different approach there. Long-term care, in the sense of regional health authority facilities, is certainly our, if not the most vulnerable, certainly one of our most vulnerable areas. And whatever we do with these areas, we take extremely seriously. There's a lot of thought goes into it. And some really difficult decisions have had to be made around visitation, for example, and this kind of thing. But when and as soon as the opportunity really presents itself to safely change those recommendations, we're certainly open to that. The thing is, if we rush it, we may well make things worse rather than better, and we don't want to see the missteps or the problems that have been generated in other jurisdictions in long-term care. That's not a scenario I want to even think about in Newfoundland and Labrador.
Thank you.
Our next questions are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
The Prime Minister announced the Canada Emergency Commercial Rent Assistance Program, and the federal government, in partnership with the provinces, will cover up to 50% of rents for qualifying small businesses. And I was wondering, how much does Newfoundland and Labrador expect to spend on this program, and which businesses will qualify?
Yeah, so businesses would qualify. There are certain thresholds that are in place, and for Newfoundland and Labrador, there's the formula can get very complicated because the first 15% of that program is covered fully by the federal government, and then there's a series of measures that have been put in place by the tenant would put in 25%, the landlord would put in 25%, and then The remaining gap that would be there would be filled by cost shared with the federal and the provincial government. So from the rental program, that is relatively inexpensive for Newfoundland and Labrador, it's less than $2 million for our province for the total rent program, but we're willing to participate. We think there's some significant interest in Newfoundland and Labrador. So today there was some changes in criteria that would allow the commercial tenants to actually get a loan of money that will go to actually support those tenants that they would have in a very difficult position. So at the end of the day, for the small business today, that's a tenant, it would be 25% of their total commercial rent, and that's if they pay less than $50,000 a month. So many small businesses in our province could be a good option for them, but it also supports the landlords as well, gives them some security.
Right. And in late March, the government earmarked about $200 million for a flexible COVID response. And Minister Osborne suggested it could be used for a lot of things, including purchasing equipment for COVID-19 response. And I'd like to know how much of that has been used and what has it been used towards?
Yeah, very little so far, none that we've been able to support the province within some of the measures that we've been able to take, and some of it we're working to recover from the federal government. So right now there would be some money that we would need to take from that it would be just a small amount. But we're also looking for ways to recover some of that cost from the federal government. As one example would be the childhood daycare that we offered for essential workers. We've been providing that money from the provincial department so far, but there might come a time when that money is not available. We need to dip into that $200 million contingency. However, we're working with the business community. We know that they've been asking now the provincial government to come up based on the recommendations that we're receiving, and that's the kind of fund there that we will be out supporting, the initiatives that we would have for tourism and others. The $200 million will be used, strictly and primarily to fill in the gaps where the federal government hasn't been able to reach for businesses and individuals in Newfoundland and Labrador.
And as a follow-up to that, I'd like to know how much has the province put aside for spending for things like PPE, ICU beds, and ventilators?
So right now that works within the Department of Health and Community Services, and so Minister Haggie would have a better idea than that. But I also know that the federal government is looking at a new testing strategy that could be a national testing strategy. That cost will be borne completely by the federal government, as they see this as one of the important ways that will be required as we continue to reopen the economy, and people continue, once we get into a situation that people can travel safely. So that initiative would be fully borne by the federal government, but the cost of PPE that we have in the province right now, that would be best answered by Minister Haggie.
Just to chip in there, we changed some years ago the way the regional health authorities' funding was done. They have essentially an expenditure cap for the year. We're currently running on interim supply. So at some point, we basically said to them, what you need and can justify, then go get. The issue around ICU beds is a planning one more than a reality. We have seen no greater than around 54, 55% occupancy up to now in the surge. The issue around ventilators is we have an order in with Thornhill in Ontario for an extra, but we actually have 40% overcapacity in terms of ventilators compared with ICU beds. Our biggest problem is, quite frankly, PPE. We are buying that out of current expenditure, but currently, because of the market conditions, we're paying anywhere from 5 to 7 times more per item than we used to in January. So that will represent a challenge, and at some point, when the dust settles, we'll figure out where that money will come from, and there will be the discussions with Treasury Board.
Yeah, so and I will say to that too, as the minister and other departments that we have within the provincial government and in other provinces as well, we've had lots of discussions with the Prime Minister and the Deputy Prime Minister in the impact, the financial impact on our province just related to the pandemic. And so we are tracking those expenses across all departments within government and having discussions with the federal government and the interest on them in actually picking up some of the expenses strictly related to the pandemic within our province. We know that even as we move into the future, delivering health care, as the minister has said, it will even become more expensive just to do elective surgeries in the future as it would have been in the past, just because of the use of PPE.
Thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead. Ben, please press star 1. Seems to be a little bit of trouble there. We'll go on to Peter Cowan of CBC News. Please go ahead.
Premier, looking at Manitoba, they're proposing having all public servants take 5 days off as unpaid leave in order to deal with climbing COVID costs. You've talked a lot about having Ottawa pick up some of the finances, but what specific measures is the province doing to try and reduce its expenditure?
So right now there's a number of measures that would have been taking place by the Minister of Finance and Human Resources and so on. So there's not a, we know about attrition, we know about the plans have been put in place. We just recently, we have a number of people that are working from home. So, the decision that's been taken now by the provincial government is not to lay off public sector workers. These are not people that would typically be able to apply for many of the federal programs, and laying off public sector workers right now would cause bumping within the system as people based on seniority and so on. So during this pandemic time right now, we've made sure that we're not in a position. We want to make sure we have confidence in our public sector workers. There's a lot of them are working from home, and it's important that we be able to do that at this critical time, for our province. We need as many people working in this province as possible. We know the business community will be relying on them as customers in the future as they open up as well. So this is really about the economics of the province and making sure that we do not cause too much disruption, that we come out of this health pandemic and ready to support the business community, help them rebound into the future.
The province of PEI just announced that on June 1st, they're going to allow people who have summer homes to be able to apply to enter the province. They'll still have to do the usual isolation. Is there a timeline for us being able to allow something similar?
We haven't looked at that at this point, but certainly we will be looking at epidemiology elsewhere in the country to inform that decision in the future.
And a question about PPE, following up on some of the similar questions from my colleagues. We're hearing at Eastern Health that it's PPE right now that's limiting the ability to do surgeries rather than staffing or bed capacity. Can you give us an idea, what's our current burn rate, and where are the specific areas of most acute shortage?
The information I have as of this morning is that gowns are the biggest drawdown in the sense of their use hasn't increased, but their supply has decreased. We have had some reusable gowns delivered at the weekend. I think we had 30,000, which will certainly go some way to improve that. We have had discussions through the department with the RHAs and specifically Eastern Health and said, are you at a situation where your PPE requirements are such you cannot increase the planned surgeries as discussed? And they have quite clearly told me they can manage, and if that changes, they will let me know.
So, Peter, this once again illustrates the importance of making sure that we stick to public health guidelines, having an outbreak, within the province, and then you have your health system ready to respond. No matter where you go in this country today, this is just not something that's an issue in Newfoundland and Labrador. This is an issue that's in every single province in this country around PPE now. So it's critically important that, as we open up the province, we must be able to do so. And knowing that we can respond to a flare-up if required. And your question is a great one, because if the PPE is not there, then health officials and people or health professionals would not be able to appropriately respond, but not just in Newfoundland and Labrador, throughout the whole country.
Thank you.
We'll now go back to Ben Murphy of VOCM News. Please press star 1 and go ahead. Operator, are you able to manually open Ben's line? Because I know he is trying to get through.
I can. One moment.
Thank you.
His line is now
Hello.
open.
Thank you. Dr. Fitzgerald, I just wanted to go back to further to what Peter Jackson said earlier about procedures like those Botox injections for those with cerebral palsy every few months. I've heard from one particular family who had appointments in March that were canceled, and obviously there are many life-threatening conditions and procedures that need to be handled in hospitals. But is there any plan at all to maybe open, clinics of these types off-site so people can still go and get these treatments in a safe manner?
If these are being offered through the regional health authorities, which if they're getting them for medical reasons such as cerebral palsy or other muscle spasms, then generally that's done as part of the regional health authority. So I would have to defer comment to the regional health authority in that situation.
I can pick up a little bit on that then, if you want.
Of course.
The issue around Botox is its use here. I think Peter's earlier question was around aesthetic, non-insured usage. Botox for muscle spasms and migraines and those kind of things is a recognized treatment. The priority that's placed on those is done by the specialist administering those. They have complete discretion to decide whether or not these can wait or can't. Now, in terms of moving those off-site, it's interesting you should bring that up because we had at one stage discussed with Eastern Health through the department about moving some treatments out of the complex at the Health Science Centre when we had significant numbers of COVID cases. And I'm thinking there of the risk to immunocompromised chemotherapy patients, for example. That didn't get past the planning stage because by that time our numbers had started to decline. Certainly from the point of view of opening things up, the challenge there again rests on what does a specialist regard as the clinical priority? That's the absolute decider. And the next bit then is within that envelope, how much PPE have we got to be able to provide that service? And at the moment, Eastern Health particularly, and the other RHAs, tell me that they can manage with what they have planned in terms of increasing their elective services at the moment.
Okay, thank you. And just as a follow-up, Dr. Stephen Major said on VOCM this morning that he believes the province may be approaching the pandemic a bit too cautiously and perhaps causing unintended consequences to those who are unable to access medical services. And just looking for your response to that.
Well, it's interesting. I've done a rough body count of doctors who write to me expressing opinions on whether we're going too fast or too slow. At the moment, the too fast crowd are winning, and the too slow crowd to which Stephen belongs are actually losing the count on terms of emails. That's not an invitation for every physician in the province to write to me, of course. That's just simply an observation of what's going on at the moment. And I think that's reflected by the comments that we've seen in the media. But it's also, I think, more importantly, founded on good, sound public health advice.
And correct me if I'm wrong here, but I believe dog groomers can now do grooming work if there is a letter from a vet, which incorporates another extra charge. But I guess, why can there be dog and animal daycares open, but groomers are not allowed to operate without this letter? Just what's the difference?
So there is some grooming that can happen without a letter from a veterinarian at the moment. And certainly if they're in a daycare situation and there's a danger to the staff or the animal, then that can happen. As I said before, these are things that we are considering, and we have engaged with dog groomers to develop some recommendations around that.
Great, thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Beginning of the press conference that you're planning on announcing some changes to regulations and provide some support for business. Could you tell us a little bit about what regulations you're looking at, and if are there certain businesses that you're looking to help in particular?
Well, no, we're looking to the business community in a very general sense, Patrick, is what we've known with the level of engagement that we're having now in the last few weeks with the business community, there's a number of things. It's not always financial. There's some regulations that we can change, and actually, in some cases, it's just simply as you do business during the pandemic, it might require some regulation changes. Simply just making simple changes in many cases. But right now, the level of engagement is in place. We recognize that there is a lot of situations, and for a lot of industries, that the federal government measures are just really not getting to them. And so our role right now as a province is to get in there and fill some of those gaps. We also recognize that the tourism industry in our province is going to be very difficult for them to come anywhere close to where they would have been in the past or what they would have been expecting for this summer. So right now this is a group that we're working very closely with. Their concerns are immediate, but also there's not too many businesses in this province right now that have not been impacted. And we're also working very close with the oil and gas industry and with our federal government to make sure that we support them in their measures. This has a tremendous economic impact on Newfoundland and Labrador. And I think all of us in recent days have seen the news coming out of that industry, representing over 30% of our GDP. There's very little in this province that they do not impact as well. So there's just two examples of groups that we're working very closely with, and you could expect something, becoming announcements on those in the very near future.
Do you know when you're hoping to make that decision or to make that announcement?
I can't give you the date, but I can guarantee you there will be a media advisory going out when we're ready to do so. There's no date set right now, Patrick, but as always, when we're ready, when we have it ready, we'll let you know, and more than willing to take your questions in a very specific nature on what it would mean to the economy in our province.
There's been suggestions from some corners that part of the reason the province is taking such a cautious approach is that the health system is in bad shape, and the people that we're worried that any spike could be disastrous. What do you say to people who might have that opinion?
I think
it's.
Yeah, go ahead, John.
Sorry, Premier.
No, go ahead.
No, I think it's a mischaracterization, Patrick, to be honest. I mean, we have a healthcare system in Newfoundland and Labrador that has some excellent results. It certainly has challenges, but overall, we lead the country in certain aspects of oncology, for example, in head and neck surgery, and these are things that never really get highlighted very well. I think at the moment, we have taken the view that we are an isolated province geographically and will have to fall back on our own resources. Part of our discussions with the feds, for example, have been around keeping adequate supplies of reagents and PPE beyond what our population would necessarily need on any given week, simply because, the ferry and the weather and these kind of things makes delivery and supply chain much less predictable. That's worked to our advantage in terms of, I think, the pandemic. But I would go back to say that really and honestly, I think that's an unfair characterization of the hard work that is done by healthcare providers in facilities and in the community across this province. We have some of the best mental health services in the country. People come from outside to look at that. We have some of the best long-term care and seniors practices in the country. We have some of the best acute care specialists in the country. And I think to run down the healthcare system pre-COVID is unfair.
I would also say that there are many provinces that are looking at the measures that were put in place in Newfoundland and Labrador. We acted swiftly, and we had a great team behind us that were there to support us. And part of that team were Newfoundlanders and Labradorians themselves. They start following guidelines, and because let's face it, we had some early scares in early days of this pandemic in Newfoundland and Labrador, and so there are many provinces now that looked to the east and followed some of the lead that we're taking right here from this province, and And we see the situation that's unfolding across the country. And that's not to say, as the minister says, so often we're not out of the woods, and we realize that we can have setbacks, and all you need to do is look around the world and see the experience that's happening there. There have been flare-ups and setbacks as people started to reopen. So we're opening a little cautious. We're going to do so because what we're trying to prevent is further setbacks. And I think we just go back to some of the comments that Dr. Rahman would have made a few weeks ago, to Newfoundlanders and Labradorians. And let's never forget that, we can have a setback and be back in the same position we were less than 2 months ago if we do not strictly follow those guidelines.
Thank you, Premier. We'll now start a single line of questioning, starting with Peter Jackson of the Telegram. Please go ahead.
We hear about a lot of people, despite best efforts, falling through the cracks in terms of emergency handouts. They're still having trouble making ends meet. Is this province, are you able to access locked-in RSPs for hardship reasons? And if not, why not?
I'm not sure what the regulation would have been around, but I think there is some relief, I know, from some levels of pension funds that you can access for hardship reasons. The RRSPs that you're talking about right now, typically these are federally regulated. So how you can get at those, I mean, depending on how old you are, I would guess, Peter, because there is a certain age there when you must start the withdrawal within your RRSPs as well. But most of those would have been federally regulated. But if memory serves me correct, there are some aspects of pension funds that people can access. But I'd have to check that out and get the accurate specifics of how that would work for people in our province.
Thank you.
Our next question is from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Premier, I'm hoping you can address this. We've heard it again about the reoccurring rumor mill and photos of vehicles without a province plate. I know this is addressed in the preamble, but what do you have advice to those social media warriors who continue to assume that these are tourists?
Oh, the license plates you mean from out of province? Or
and the rumor mill, and the posting it on social media, all of that.
Yeah, we see that. Quite often, as we said, and that's not to dismiss it, by the way, at all. I think if people have somebody that they want to report that they think that they're in our province, and they shouldn't be here, well then, you can report it. It gets followed up on. There's mechanisms in place to be able to do that. But what I will say, as I just mentioned, that those that are coming in, we have tight border controls in place. We can give you the numbers of who are coming in to Newfoundland and Labrador through every single entry point that we have. That would be including those that are crossing the ferry and the Straits Ferry at St. Barb, going in to Labrador and Labrador West and into Happy Valley, Goose Bay, St. John's, and into Port aux Basques as an example. So we have the information coming from there. The border controls are in place. We have officials there. So if there's someone that can actually get in through all of that, maybe, one or two people, well, if they report it, we'll look into this. But very, very limited numbers, and very confident in the measures that we have put in place at our borders.
Thank you.
Our next question is from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Thank you. I just wanted to follow up on an earlier question I asked about the Canada Emergency Commercial Rent Assistance Program. I was wondering, Premier, could you give me a bit more detail or clarification on which businesses will be able to qualify for it?
Well, I think right now this is the criteria changes today were primarily about those, commercial landlords there would be a loan that they could access, and that loan would be to offset and provide support for their tenants. And they may not even have to have a mortgage in place. They would just be missing the rent that would have come from the tenants. So there are some thresholds there. This is the details. I have not even read all the details on this. This is an announcement that just came out, just literally 45 minutes or so before coming down here today. But I know this is in addition to some criteria changes that people were looking for the landlords, and now they are in a position to get a loan to support their tenants as long as there are certain thresholds for those tenants. As an example, $50,000 a month rent or less. But it doesn't mean that the tenants are off the hook. They have to pay up to 25% of their total rent. So this is really making sure that the tenants can stay in place to find themselves having their place of business available to them as we work through this health pandemic and get those businesses back employing Newfoundlanders and Labradorians and people from across the country.
Thank you.
The next question is from Ben Murphy of VOCM News. Please go ahead.
Thank you. Minister Haggie or Dr. Fitzgerald, we talk a lot about this second wave and the modeling, but obviously we did much better than predicted numbers originally. So I guess what evidence is there that this second wave is in fact coming?
So I think the evidence is just what we know about pandemics in general, and that, once you start to loosen measures, the circulation of the virus is not really zero anywhere. Once you start to loosen measures, you're going to see a starting spread of this virus again. I think, with a second wave, we will be more in tune to the occurrence of this virus. We'll be certainly watching very closely, and we will have measures in place to be able to deal with it. And having gone through it once, we'll be able to respond appropriately. But yeah, it would be certainly exceptionally surprising if we didn't see a second wave, just based on what we know about the way these viruses move through populations.
Okay, thank you.
The next question is from Peter Cowan of CBC News. Please go ahead.
Now that we know that schools are going to be closed till September, a lot of parents are facing a long summer. They're worried about looking after kids while also having to return to work. Can you explain what's the plan for summer camps and what measures are going to be there in order to help parents be able to get back in the workforce?
So summer camps are in the next level. So we're certainly engaging with municipalities and other groups that are doing summer camps to discuss how they can do that safely within keeping the public health measures in mind, and with screening measures as well with regard to symptom checks and things like that. These are all things that we have to put in place to ensure that people are able to return to work and that children can be cared for in a safe environment while their parents do that.
The next question is from Patrick Butler of Radio Canada. Please go ahead. Patrick, please press *1.
Hi, sorry, I was on mute. A question related to teachers. Teachers in New Brunswick will be back in school at the beginning of next month, not teaching, but back in place, setting up lesson plans for next year, and I guess taking advantage of the materials that they would have within a school environment. Is there a plan to do that here? And if not, why not?
Yeah, so, one of the professions that's like many professions within the province that has seen significant change and had to move and adjust rather quickly. That is, of course, the life of teachers and the life of students that they normally teach on a daily basis. So right now, I know the NLTA, working with the English and Francophone school districts, with the support of the department, they're working on, what opportunities do they have now before the school year is officially closed. Can we work on professional development, the number of scenarios that we need to explore as we look forward to working or opening up the schools in September, what that fashion would look like, online learning, the way the classroom changes could be. So Patrick, there's a number of scenarios that are being explored right now, but also professional development for teachers on if indeed we open up in an online learning environment, they're prepared and have the professional development to support them for September in this year.
Thank you, Premier. We have time for two quick questions, so if you would just press *1, the operator will identify you.
The first question is from Kellyanne Roberts.
Go ahead, Kelly.
Thank you. Thank you. Wondering what the course of treatment here is if you are admitted to hospital with COVID-19. Obviously, I know underlying health conditions play a factor here, but have we been looking at any of the treatments and some of the drugs that are being used south of the border or federally?
So I think treatment of any patient has to be left up to the clinician. I certainly wouldn't feel qualified to discuss treatments in particular. So I guess that's all I can say with regard to that question. I don't know, Minister, if you have anything to add there.
Thanks, Janice. Yes, I do know that the Infectious Diseases Group at Health Science Centre is enrolled as a participant in a couple of trials across Canada. My understanding is that they have not actually had patients yet suitable to enroll in that trial, but certainly as good academics and interested researchers, that they're in there with the rest of the country to participate should the need or opportunity arise.
The best medicine, Kellyanne, the best medicine is always prevention, and do whatever you can to not expose yourself to this virus.
Thanks.
And our final question today is from
Peter Jackson.
Go ahead, Peter.
Hi, I'm wondering if you can tell me, assuming you know, whether fertility treatments and specialists, whether there have been any changes with that under the pandemic.
My understanding of the fertility clinic in St. John's is that it has suspended operations until the pandemic or the state of emergency is cleared up. Those facilities outside the province to which patients may have been sent in the past are, to my understanding, also closed currently or have been up until today in other jurisdictions for the same reason. So, in a sense, that has been put in suspended animation until such time as the country comes out of the first wave.
Thank you very much, Minister. The time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening.